expand and talk a little bit more about surgery, because what NCH has accomplished from a surgical perspective over the past 4 years is really remarkable. Dr. Lamelas, with you joining the team, you're a pioneer. We've been talking a little bit about minimally invasive and some of the things that you've done in your career. Can you share a little bit more for patients on what you're bringing to NCH and how you're expanding upon our already great surgical team?
Great. No, I'm proud to join a team of great cardiac surgeons, and my goal here is, as I mentioned before, is to develop a world-class minimally invasive cardiac surgery program. I've been pioneering many techniques for many years, and now when I get to the operating room, I'm not trying to figure out how to do the operation, but I'm trying to understand how to make it better and how to expand it to different pathologies. Recently, well, in the last 5 years, I was able to pioneer a technique to replace the entire ascending aorta and part of the arch, which through a 5-centimeter incision, which was one of the first in the world. And throughout the years, I've expanded this procedure not only to do single valve operations, but to do double valve operations to correct congenital defects in the heart. So some very reoperative surgery, so very, very complex operations through very limited incisions, which I believe are the least traumatic to the heart. And the one thing that is very unique as well is that this is a particular operation that could be expanded to almost every patient. There are very few patients that are not considered candidates for it, and this is, I think, very unique, because if you travel to different institutions around the country, around the world, there's a lot of contraindications, but I've been able to expand it to the point that there's very few patients that are not candidates for this approach. And not only am I doing these operations here, but I'm also going to include my colleagues so they continue to do what I do, and then we could expand it to an even larger patient population and continue to grow the Institute on a daily basis.
One of the things I think is incredible about Dr. Lamelas is that if you're a patient and you think about open heart surgery, you think about that your chest is cracked open, that your heart is going to be stopped, and then through a big incision right here in the middle of the chest. And what's remarkable about the procedures that he has innovated and pioneered are that these now can be done through incisions this big on the side of the chest that's sort of well hidden. And that's what's truly incredible. And patients actually, on the most part, do better. We've done big national studies that show that patients will leave the hospital earlier, they recover faster, and if they're candidates for this type of procedure, he's really the pioneer in the field. Before I even arrived here and even got to meet Dr. Lamelas, I was using his retractors, his instruments that are named after him, that he developed to help support these procedures, which is really truly incredible now to be working with one of the masters in the field here, and especially for the patients now, to have someone here so close to home that can offer them what all the surgeons around the country are using in the operating room to do the same procedures.
And one thing I like to say is that when I was working in my previous institution, I had patients that would come from all over the state, all over the country, even internationally. So now we're going to attract those patients here, and any patient that lives in the area does not have to travel to another institution thinking that they're going to get a better procedure, better operation, because we could offer that here, and even with the best results in the country.